Hello again. This is Dr. Rich Lee coming to you from the inner wilds of Mendocino County. I'm a family physician, which means I'm a regular licensed MD. I'm not a naturopath or a homeopath. I'm not a chiropractor. I've been accused of doing some of those things sometimes in my practice, but basically it's a fundamental primary care practice with a few twists. I've been incorporating nutrition in my practice for at least 15 years, and for 10 years I had clinical nutritionists in my practice who mentored me and taught me everything they could. I must give a lot of credit to two people. One is Laura Sigelman, who was with me for quite some time, and the other is Julie Rausch, who currently runs a website and service called Eclectic Wellness. In addition, I've been integrating genomics into my primary care practice. I've been looking at people's genome and the data and relevant data for at least 15 years and followed these people over those years in continuity of care. So not only do I know what their gene variations and mutations are, I have a pretty good idea how it affects them. And more importantly, through literature and experience, I found that you can actually modify the expression of these genes. My one observation, especially the most recent years, is there are many websites coming out that are now direct B2C or business to consumer websites on managing your DNA data. What I have found is that many of these are very complicated. They provide a great deal of really useful information, providing you have the time to dig into it and read it over and over and over again. The question is, how much of this can you actually apply to your health and quality of life? Well, my trademark phrase is, it's not your genes, it's what you do with them. And so what I've been learning over the last 15 years in applying this is, what are the genetic variations that are most actionable, that you can do the greatest amount of good with the least amount of time and complexity based on what we know about your DNA. It's not yet available. I'm working on an algorithm and an app that will actually give you that information in the simplest forms. Of course, again, it's not your genes, but it's how you interact with them through your nutrition, through your lifestyle, through your exposure to stressors and other environmental risk factors. My grandfather is famous for being a skilled diagnostician. He started the largest private group practice west of Mayo Clinic, and his fame was being a diagnostician at a time where there are no technologies and no real imaging to determine that. So what he told me is that if you get the right answers to the right questions, you can figure out 90% of what's going wrong with someone or what they could do to feel and live better.